Hi, listeners. It's Mimi, and I'm back with another authority, and she's a beautiful woman, and her name is Dr. Jenny Tafinkian. And she is a licensed neuropathic physician with 2 decades of experience, and she specializes in empowering health conscious professionals to look at things like long COVID and chronic fatigue syndrome, which I had been diagnosed with 30 years ago. And she's very knowledgeable. Say hi to everybody, Dr. Jenny.
Hi, it's wonderful to be here with you.
Great, great. I can't wait. Um, well, the thing of it is right now, yes, we had COVID in 2020, and some doctors are saying that people with certain conditions have them because of the COVID. And that might be true. Um, but what I really am interested in is autoimmune diseases. Um, I had this, maybe I'm wrong. Do mostly women get autoimmune?
They're more likely to get autoimmune, but it's not just women. Men get it too, for sure. But
Yes,
there are slightly more women that get autoimmune than men
yes. And
in general. Mhm.
I blame that on stress. It's more stressful to be a woman. It's true. And so
It's
like
probably from a medical perspective more to do with the hormones than it is culture, but there could be a cultural aspect to it as well.
yeah, that's right. And stress sometimes leads to inflammation in the body, and
Mhm,
inflammation in the body leads to certain diseases. So
mhm,
to me,
mhm,
I'm always thinking about that connection. And for 30 years now, chasing down my own problems, which um, I had brain fog. I had a wonderful job working with disabled people.
hmm,
And I was a little tired, but that's okay because I was on the road. I was driving a lot, and I was, about 50, I guess. And I started forgetting how to get to their house or get to my house. I think
mhm, mhm,
called
mhm.
my husband crying on a payphone. That's how far back I'm going. And I said, I'm like, Wilkes-Barre. I don't know how I got here. And like, I finally had to retire at an early age. And I went to a neurologist and she tested for those tender points, trigger points.
Mhm,
Back
mhm,
then they said if there's 12 of them and you have 5 out of 12, whatever, I had all 12.
mhm,
All 12.
mhm,
So she
mhm,
said fibromyalgia. That
mhm,
was
mhm,
19
mhm.
something. Anyway, but at that time, myself and a lot of other people thought that that was just when they couldn't figure it out, they just threw it under that umbrella.
Mhm, mhm, mhm,
I
mhm,
think sometimes they did, you
mhm,
know.
mhm.
So I didn't find out about Sjogren's syndrome, which I believe I have for years. And then doctors started saying, you have all the symptoms of Sjogren's syndrome, but you don't have the blood marker.
Mhm, mhm.
So they would give me medications for the symptoms, the aches, the pains, the depression.
Yeah, right, right, right.
I think, does that happen a lot that physicians treat the symptoms instead of trying to pinpoint what it actually is? Or,
Yes, it does happen over and over again. And it's really a lot about how the medical system is set up. I think our medical system is set up for critical and acute care, and it's really good for some of that. If I'm in a car accident or somebody's having a near-death emergency, I think our system is actually good to take care of that. Unfortunately, most of the illness that most of us experience, most of the problems that most of us have with our health are more of these kind of chronic, really, they can be very intense experiences of pain and fatigue and mystery symptoms, sharp shooting pains, random stuff that goes on that your doctor doesn't really know what to do with. And that's because their training isn't for those kind of conditions, unfortunately. And especially if there isn't a specific test that gives it a specific diagnosis, and then there's a specific name for it. And that's really the problem that we had with chronic fatigue syndrome, now called myalgic encephalitis. And then fibromyalgia is really a continuation of that. It's very similar, but it has a different representation in the body. And these these types of things, you did feel like you were just being kind of ignored, or put down the hall to the psych unit was usually what happened. Take some antidepressants. Or I still have patients today who are told things like, oh, it's just your age, but they're 35. Or it's because you have 3 kids. Or it's, of course I'm tired too, we're all tired. I mean, those are not valid responses to have. And it's really just that the medical system, a lot of these physicians are not trained to look for the root cause. They're also not paid by the insurance companies to take the time that they need to ask you the questions to uncover what are the root causes and why is your body doing this. And that's a huge part of the problem.
And I did the research. I will always research things. And I go to like Mayo Clinic sites or Cleveland Clinic, like reputable,
Yeah.
not search engine. And I found this connection. I was having the hoarseness and the cough, and having problems with my vocal cords, etc. And I found this connection about the lungs and, Sjogren's. So April 3rd, I had respiratory failure where I had to actually go to the hospital.
Yeah. Wow.
My stats, oxygen levels,
Mm-hmm.
80s, in the 80s.
Wow. Really
And
low.
yeah, and I'm the concierge doctor now because I had so many problems.
Yeah.
When
Yeah. Yeah.
when he went
Yeah.
concierge, I said, "I'm with you 20 years. I can't leave you."
Yeah.
And he's great. But he hardly believed me. He said, "It can't be in the 80s." I said, "Well, I'm gonna send you a picture." So
Yeah.
I took pictures of 4 different readings in the 80s. He said,
Yeah.
"Walk in, get a check." I said, "You know what, doctor? I'm not going into a regular walk-in. There's a place down the block. It's associated with a hospital that I've been to. And it's like a step up from a walk-in. A
Mm-hmm.
step,
Mm-hmm.
like they
Mm-hmm.
have a cat
Yeah.
machine.
Yeah.
Yeah. So I'm glad I went there. So I went there, and they treated me. They gave me steroids. They gave me medicine. They gave me oxygen. They got me back up into the low 90s. And they
Mm.
were home. And he called me, and he was talking to me, and he said, "Did they do a CAT scan?" I said, "No." So I called the emergency doctor over. I said, "Talk
Yeah.
to my doctor." And he's so funny because I don't want to tell him to do it. See, that's just it. It's like they don't want to
Hmm.
step on each other's toes.
Mm-hmm.
But he said, "I will suggest it." And so the doctor did the CAT scan, and the nurse comes back in the room and she said, "You're not going home. You're going to the hospital.
Oh my.
We found something." Now, long story short, I go to a pulmonologist. I didn't have one. So I go to one that's supposed to be very good.
Yeah.
And Dr. Jenny, she spent the first half of that appointment grilling me on why I thought I had Sjogren's syndrome.
Interesting. Wow. Yeah.
And I was getting ticked
Yeah. I bet you were. Yeah.
because I said, here's I gave you all my records. So finally, and she kept bringing up the ANA, and you
Yeah.
don't have. Finally, I said, doctor, I said, you know that any doctor worth their salt could prescribe an illness without markers.
Mm-hmm.
I'm bold. So she sent me for a CAT scan. I thought I had a CAT scan. And
Uh-huh.
she said, "Oh, I don't think it's anything." I said, "Well, the ER doctor, the hospital doctor, and my doctor all looked at it, and they all saw scarring, right?"
Uh-huh.
She
Uh-huh.
sends me, I have another one, it says scarring.
Mm-hmm.
I'm not going back to her.
Mm-hmm. Mm-hmm.
I
Mm-hmm.
go to I'll wrap this up soon. I go to the second pulmonologist, and I go in there, and he gives me a breathing test, and he listens to me. And the minute I mentioned Sjogren's, he said, "Go to a rheumatologist for that."
Mm-hmm. Yeah.
So he didn't want to. So I don't know if I'm going back to him or not. So what are you gonna do? Now, what's your story? Because I think you have something, you have a chronic disease. Am I correct?
Well, the reason I specialize in helping people with myalgic encephalitis, chronic fatigue syndrome, and long COVID is because I've had so much personal experience with it that I've gotten really good at it and understand it extremely well. There's nothing like having the condition to really drive you to what I call solving for X. I'm always interested in understanding what we're discovering and sort of the cutting edge science, what works in clinic, where and how I'm seeing people get from this place of feeling exhausted, having brain fog, feeling scared, feeling like they're not getting the answers, that they are going to practitioners like you're talking about who just don't really believe them or feel like they feel like they're misunderstood. They're told their labs are all normal and they feel terrible. They know they're not normal. I'm seeing what is it that I see when I work with those people so that we can we can get them to feeling like they can be normal again and have energy and start planning ahead for exciting things. It's a really fun transformation to observe and to be part of that guide for people. So my story is that I was a second year medical student and my son was 5 and I decided to become a doctor when I was 6 months pregnant with him. And so he went to pre-med with me and then we went to medical school together. And
Oh,
we so that was yeah, that was fun. And I decided it was time to have a second child, and I had a series of miscarriages, and one of them was at 17 weeks, and I hemorrhaged and was passed out and had to be rushed to the hospital. That severe loss of blood and the crash of the hormones and the grief just tanked me. I went into what I call a dark night of the soul, where I really was just lost. I mean, I could only lie in bed. I couldn't eat. I couldn't sleep. I was in deep, deep, deep anxiety. I had severe depression. I was suicidal and I felt lost. And yet it was through this really just absolutely stopping my life. I'm sure you can identify with this. I was the rock for everybody else my whole life. I was the one that could always function. Everybody came to me for food, for counsel, all that kind of stuff. And for me to just be out of commission, I had to let the world spin without me. And that was the first time I'd ever done that in my life. I was in my early 30s. It took me months from amazing people coming to literally to my bedside because I couldn't get downstairs. I had to be walked to the bathroom. And they came and they did therapy with me. And one of the most powerful was a hypnotherapist that came and worked with me by my bedside twice a week. And we broke through some really deep subconscious layers that had been holding me back from healing. And that helped me break through that severe anxiety and depression. And from there, I was able to move from the bed to the couch. When I moved to the couch, I didn't have the anxiety and the depression anymore, but I was tired. I took a whole year out of medical school, and one of my therapists said, "Do you have chronic fatigue syndrome?" And I was like, "Ah, get that label away from me. I do. This is the 90s. I don't have the yuppie flu. Don't put that label. Yuck, no way, forget it." And then I was like, "Oh gosh, maybe."
track.
What's
Let's
that? Say it again.
backtrack to the anxiety depression part.
Mhm.
I did not realize that I had chronic depression and anxiety disorder. And it might be genetic. I don't know. My father's an alcoholic. He had lots of problems. I had a lot of things going on in my life, but I self-medicated with alcohol
Mm-hmm.
for 20 years.
Mm-hmm. Mm-hmm.
And when I finally, when you said Black Night of the Soul,
Mm-hmm.
when I had that dark night of the soul where I didn't want to kill myself, but
Mm-hmm.
I didn't necessarily want to live,
Mm-hmm.
had everything going good in my life,
Mm-hmm.
business
Mm-hmm.
wise, husband, family. And I was, to the point now where I was becoming a blackout drinker, which I never was.
Wow.
But, but I had been in an accident and been given painkillers and muscle
Uh-huh.
relaxers. And I
Mm-hmm.
still thought I could have a couple of drinks.
Oh, wow.
So I should be dead, seriously.
Yeah, right?
When you read my book, which I'm going to send you, want to do another podcast. But so anyway, when I went to treatment, that was my decision. Of course, I have to be truthful. I thought I was going to a health spa. I didn't know anything about rehab. I brought my bathing suit magazine.
That's so funny.
But it's true.
Huh.
But I had to get a rest from all this craziness.
Yeah.
Got detoxing when they were talking to me, and they did all kinds of blood tests. And they said, you have depression and chronic anxiety
Interesting.
disorder, and you're self-medicating instead of taking
Uh-huh.
a depressant.
Yeah.
What they gave me was an
Yeah.
antidepressant. So that helped. And I'm sober 33 years.
That's fantastic. Congratulations. That's amazing. There's so much bravery and courage to face that and then to actually go through the healing and maintain it. Yeah,
Yeah.
absolutely.
I
Yeah.
had gone through a lot of stuff even before that, but which brought me to the drinking. But I'm getting at that. There's a connection definitely with, I think you read this too, the brain, your GI system, and
Mhm.
autoimmune, because I have GI problems. I
Mhm. Yeah.
of 85% of my stomach,
Yeah.
80% of my stomach, because it had
Yeah.
an infection that went through it. And I would have died. I would
Yeah.
have, this is
Yeah,
7 years.
you've been through so much. I remember hearing that in one of the other podcasts I heard about how you had that infection from the lap band surgery that went bad. So, yes, absolutely. There is a huge connection between the gut and the brain and the nervous system and the moods and all of that. And I'd say for me, I work with a lot of my clients and I do subconscious work with them when they come in and see me. And it's interesting the anxiety piece. For some, anxiety can be caused by many different things, but often can be stuck anger or stuck grief that was not safe to give voice to or was kind of hidden.
Right.
And it was very interesting once I did the subconscious work. Later, years later, one of my relatives died. And it was very interesting because I could feel the grief and I could feel that grief come on. And I could see how before I did the subconscious work, that was a hook that took me down to this place that then threw me into feeling really anxious or
Mm.
having low blood sugar symptoms or going into this whole physiological crash and crisis where I couldn't function. And because I had done that work, it's like it didn't hook onto anything. It was just grief. It didn't need to take me down that dark alley. So I think
Right.
sometimes we have these spins that we can go and that take us down the dark alley. And yes, you can have a genetic propensity towards depression. My dad really struggled with depression, so that's in the family lineage, as did his mom. And there's generational trauma on both sides of my family. And all of these things have an impact on our psyche. We literally inherit these patterns. And there can be soul patterns as well that we can be working through in this lifetime. I believe that's been my experience. I think we all have different beliefs, and that's great. I totally honor everyone's different belief.
Talk
But
about
that's a real piece of that. And so sometimes those anxiety and depression things, we have a physical body, a mental and emotional body, and an energetic body. And that dis-ease or discomfort can be on any one of those levels. And part of what it's important that we listen to is which level is this illness happening on? When I was crashed out in bed that first time I was sick, all three levels were down, which is why it was dark night of the soul, can't move my body, can't function. Most of the time we have one or two systems down, not all three. And so we can, if you're conscious of that, you can use the system that's functioning well to support you. So if you've had a horrendous loss and you're grieving, or you're feeling really angry, you're going through this emotional thing, but your physical body is still strong, you can move your body and move some of those emotions physically through your body. And vice versa, if your physical body is really down from chronic fatigue or an autoimmune condition or cancer or surgery or something like that, yet your spiritual body, your energetic body, your emotional body is doing okay, then you can really use that to just bathe that physical body in all that beauty and abundance that life is, right? You can let it actually help you. So if you're conscious, you can become aware of, like, where am I strong? Where do I need support? And you can support yourself
and
in
that's
your
what
healing.
that people do for the most part. And for me, my father had tried to commit suicide more than once.
Mm.
Okay, so there's the genetic
Mhm.
alcoholic. I went through a lot of trauma with ex-husbands. I had 2 ex-husbands.
Mhm.
Don't know how I survived them. And but when I was after treatment, they said you're cross-addicted and dual diagnosed. And I said, well, what does that mean? They said, well, you have these psychological factors going on with the anxiety and the depression. And being that you were also taking pills, you put down alcohol, you have to put down pills too. And
Mhm.
your personality and, your complex of your psyche, you're going to pick something up.
Mhm.
Guaranteed it. And I thought, I am not going to pick up alcohol or pills. So I picked up food,
Mhm.
which is
Mhm.
very
Mhm.
common with recovering alcoholics because of the sugar, right?
Mhm. Mhm.
And 9 months sober, I went to treatment again for eating disorders.
Oh, uh-huh.
Yeah, and I did a lot of good work there, and I got a handle on that. And then
Yeah.
5 years sober, I got very depressed, even though I was on antidepressants and going to counseling.
Mhm.
Um, and I got very depressed, and I went to the Karen Foundation, who has a 5-day program. They only take 6 people
Mm.
at a time, and
Mhm.
they family of origin work, and they do the role playing and the release. It
Oh, wow.
was fantastic.
Oh, sounds amazing.
But I actually went away 3 times, and in 5 years, and my current husband, who I'm with like 35 years, actually, I'm with him 37. We're married 35. He said to me at the time, are you going to go away every year? He said to him, I have to. I
If I
was
need to, I
committed.
will.
I was committed to being home,
Yeah.
but the
Yeah.
spirit didn't come along until much later. I would
Mm.
say maybe 20 years ago.
Uh-huh.
I got into New Thought,
Mhm.
spirituality, which that's a whole, we could do 10 shows on that. So all those combination of things, I
Mhm.
was doing so well. And now this propped up because it is, the Sjogren's is progressive. People don't
Yeah.
realize that, you
Mhm.
know. So I'm
Mhm.
at the next progression, but I'll deal with it, Dr. Jenny. You
I
could,
know you will. I have no concern about that. You will. And you'll use this as I did, and as I invite others who are listening to, is to use whatever challenge you're facing right now as an opportunity for growth. It doesn't mean it's fun every minute. It doesn't mean you don't have your moments of, just putting your head in the pillow and crying or going, what is going on? And we all have those moments. I do. And yet it's, what do you do after you move through that, a feeling? What do? Do you stand up, and what do you choose to do? Who do you choose to be after that? And I really think
yeah,
that's where we develop, really who we are. And as a mom, I feel like it's allowed me to to lead my children by example in terms of how a better way to handle the challenges that there just are in life, in relationships, in a body, and how you can do that well.
I truly have seen a lot of what I went through. Of course, they don't remember a lot about my first husband, who was their father. But, there was still a lot of trauma and different things when they were younger. And of course, they were teenagers
Yeah.
when I, I went to treatment.
Yeah.
And we offered the children counseling after I got sober, they
Mhm.
were children of alcoholics, because my present husband was also actively an alcoholic, but
Mhm.
and 2 of them said yes and one said no. And
Mhm.
the 2 that said yes are both counselors.
Oh, wonderful.
One is a psychologist with their own
Uh-huh.
practice, and
Uh-huh.
the other is a counselor for the VA.
Oh, very cool. Yeah.
Either one of them drink.
Mhm. Mhm.
So, you could pass on good things too. But
Absolutely.
yeah, so the whole thing is, I wanted to ask you, and I don't want, when I said about the brain, gut, the autoimmune. So the interplay between the physical health and then the subconscious healing, like I do meditation and different things to help me
Mhm.
with that. But what's like your number one go-to when you're having maybe a bad day, or you just want to feel centered?
Personally, what do I do?
Mhm. Yeah.
I have a number of different practices, and it depends on where I'm at. I think the number one most powerful thing I can do is change my breathing, because I can do that if I'm driving, if I'm making dinner, if I'm, you know, walking down the hall and I notice. It's really easy to do a breath holding pattern. A lot of us are, watch our moms do breath holding as well. I certainly did. It's easy to be in a breath holding pattern if you're in that sympathetic stress mode. And most of us are in that in this culture 24/7. And so and that's one of the reasons why it's so easy for us to get chronically ill, is that chronic stress. So the breath can really make a huge difference. And if just exhaling twice as long as you inhale can make a huge difference in terms of resetting that system. It can reset your autonomic nervous system and get you out of sympathetic mode into parasympathetic mode. There are other types of breathing techniques that are more advanced that I do sometimes as well. I like using heart maths technique, where I breathe into my heart, and I just breathe 4 breaths into my heart, and then I breathe in just feeling of love or compassion or something there, and then project
Tap,
it out. What's that?
tapping. You do tapping.
Tapping's great. I do tapping. I mean, again, many, many, many tools are so helpful. So I'll use tapping and that kind of thing. Sometimes I honestly, one that I really love, we talked about anxiety. And if you're listening and you easily get anxiety or stressed out, just literally feeling your feet is huge. Like literally just feeling your feet, just grounding, just like, where are my feet in these socks? Or where, I kick off my Birkenstocks and I just feel the ground. Just that, and just really intentionally just feel that ground is so good. So
Yeah.
that can be really helpful. And then I'm giving you lots of answers. So I'd say number one is breath, number two is just grounding. Number three is getting outside. Just for me, just or if I can't get outside, finding a thing of beauty. I frequently have flowers in my space or something I like, and just literally looking at that and finding the beauty of the petals. Or I live in Portland. It rains a lot, not today, but it rains a lot. And it can be, just that glint of water on a leaf outside can be very beautiful to me. And so that can catch my eye, and it switches my system
Yeah.
out of stress into appreciation and beauty.
I do a lot of that. And
Yeah.
I, more as time goes on,
Yeah.
stibbling, dabbling, finding out about things. But I go to a Unity church where we are not a religion, we're a spiritual community.
Yeah.
And so he's my mentor. And
Uh-huh.
I learned so much from
Uh-huh.
him, a lot of the things that you're talking about. What would you, I think I read this in something about you. What would you say is empowered self-care? Have you ever used that term?
I use
How,
that term a lot. Yes, I do. Yes, empowered self-care is really taking the responsibility of understanding what is your body saying. When your body has a symptom, or your mood changes, or you have a pain, or your energy drops, what is your body saying to you? Understanding how to decode your own messages that you're being sent, and then taking ownership of what that message is, and beginning to experiment, understanding and trialing things to see what works to help you shift. Just like we're talking about, you asked me, what do I do if I'm feeling down? Well, these are the things I do. I have another huge toolkit I do for my energy. I have another toolkit I use for my immune system. I have foods I eat that I've discovered really work well for my body. There isn't a diet that's perfect for everyone. There's a diet that's perfect for you right now, for whatever your body is going through. And empowered self-care is taking on that really fun journey of discovering what makes you run better. And ultimately, what I see is that for us I really believe the world needs us to be our best right now. And when we take on that responsibility to take care of ourselves and bring on people to help us, the guides, the people that inspire us, bring those on as part of our team to support us. But We're not expecting the person with the white coat or the pill or that outside thing to fix us. The power to heal is inside of you. So how do you bring that food in, or that supplement, or that medication, or that person in to help trigger that healing inside of yourself? And then we're really able to be the light that we are and shine in the world. And you're able to do all the things that you're meant to be doing here in this world. Because I know you're here for something,
I
you
love
know?
I'm doing a lot of research. Well, I'm writing another book. I never wrote a book until 2020,
Huh.
and it was suggested because of my depression, because I get
Yeah.
depression, everything. My husband has Parkinson's, and we're stuck in the
Yeah.
house for a year,
Right.
and I ended up writing my life story, but also reflections on it and different things about what we're talking about, And from that led into the podcast, which I adore because I
Yeah.
meet from all over the world and
Sure.
we
Sure.
topics. So
Yeah.
I'm a talker. And with the Parkinson's, the stage he's in now, he's not really a
Oh,
conversation.
yeah. So you get, yeah.
I don't go that often. So I love doing those things. And what piques your interest lately that is maybe something new that you found that we could do? Is there like anything new out there?
I think what's really been interesting is seeing how much the neuroinflammation, the inflammation in the brain is impacting so many people with chronic conditions. And that there's this huge spectrum, and we've touched upon a couple of these just incidentally in our conversation, where the same thing that causes depression and anxiety in the brain is the same thing that causes brain fog, where you're having a hard time finding words, or you feel lost, or you can't remember why you walked in a room, which is the same thing that is going on in people who have myalgic encephalitis, chronic fatigue, long COVID, or many other autoimmune conditions. And it's the same thing that leads to the dementias, Parkinson's, Alzheimer's, all multiple system atrophy, all the different dimensions. It's all the same thing. It's neuroinflammation. And when the brain gets inflamed, it's completely different than when you sprain your ankle. When you sprain your ankle, there's a natural pattern of a 72-hour inflammation cycle where it peaks and then it naturally drops off. As long as you don't re-injure it, it's going to go into a healing process. The brain has a different way that it handles with inflammation. And basically, once it's activated, it keeps going. It doesn't have a time stop in it. And so you need to do something to get that inflammation down. And that inflammation can be caused by blunt trauma, so a TBI, getting a head bonk, which we've all had at some point. I fell off the bike, out of the tree, like all the things. And that could be like the first incident that happens, and then that does this thing called glial priming, which sets up your brain to be ready to take action if another insult comes in. That next insult could be another bonk, but it could also be an infection, it could be a toxic exposure, it could be any one of these things, and then that triggers the inflammation. It's just like trigger happy, and then it becomes a vicious cycle, often with the body, where you end up in this vicious cycle where the inflammation continues, and you end up having high histamine levels in the brain that can impact your blood-brain barrier becoming more leaky and your gut becoming more leaky. And again, there's multiple things that can happen after that. You know some of those from your research.
Yeah.
And this is something that has been fascinating to me, to see that progression and to see how that happens, which is why I think for all of us, it's important to pay attention to those early symptoms of moods up and down, of brain fog, of fatigue, of all of these things are not to be shoved under the rug, to be ignored. And they're not for you to say, oh, this is me being lazy, or if I just went to the gym. This is for you.
Uh-oh. We were cut off by Zoom, which happens sometimes. We went a little over, but don't worry because I have to have Dr. Jenny back because there's so many topics you can talk about with her. So we will be having her back. And just remember to handle your anxiety with breathing and some of the techniques that you talked about, and never give up. See you next time.